Psoriasis nails. What causes pitting and subungual hyperkeratosis? Imagine your nails telling a story about what's happening inside your body. When it comes to psoriasis, that story often includes tiny pits and thickened areas under the nails. These changes happen because of inflammation affecting different parts of the nail unit. The nail unit includes the nail matrix, which is responsible for making the nail, and the nail bed, which helps the nail stick to your finger. Nail pitting appears as small, pinhead-sized dents on the surface of the nail. This occurs when psoriasis causes inflammation in the nail matrix, especially the part under the proximal nail fold. The nail matrix forms the nail in layers, with the superficial part from the proximal matrix and the deeper part from the distal matrix. When inflammation occurs here, it disrupts normal nail formation, leading to these characteristic pits. Histologically, this is linked to focal parakeratosis, which means skin cells retain their nuclei instead of shedding normally, and hyperkeratosis, or thickening of the skin. These changes cause the tiny depressions or pits seen on the nail surface. Nail pitting is quite common in psoriasis and can vary in size and pattern, often appearing irregular or in clusters. Subungual hyperkeratosis is a different but related change. It results from inflammation in the nail bed, which lies beneath the nail plate and helps keep the nail attached. When psoriasis affects the nail bed, it causes an abnormal buildup of keratin, the protein that makes up nails and skin. This buildup leads to thickening under the nail, giving it a crumbly or rough appearance. You might also notice other signs like onycholysis, where the nail lifts away from the nail bed, drop discoloration, or tiny splinter hemorrhages. These changes can cause discomfort and make daily tasks more difficult. Both nail pitting and subungual hyperkeratosis are signs of the autoimmune process at work in psoriasis. The immune system triggers inflammation that speeds up skin cell production and damages the nail structures. These nail changes are quite common, affecting up to half of people with psoriasis, especially those with psoriatic arthritis. Understanding these mechanisms helps explain why nail psoriasis can sometimes be painful or tender, and why it might interfere with fine motor skills. Diagnosis is primarily based on clinical examination, but sometimes a biopsy is needed if the diagnosis isn't clear. Treatment aims to reduce the underlying inflammation, which can help improve nail symptoms. While there is no cure for nail psoriasis, therapies like topical treatments, phototherapy, or systemic medications can help manage the condition. In summary, nail pitting results from inflammation disrupting the nail matrix, leading to tiny pits on the nail surface. Subungual hyperkeratosis happens when inflammation affects the nail bed, causing thickened keratin buildup underneath the nail. Both signs reflected the systemic inflammation of psoriasis and highlight how this disease can impact even the smallest parts of your body. If you notice these changes, it's important to consult a healthcare professional for proper diagnosis and personalized treatment options.